Hi, so this is our presentation, Transgender Women and Why is the Mortality Rate So High? My name is T. Cahill.
My name is Alexa Rodriguez.
My name is Karanjot Kaur.
My name is MC Hernandez.
My name is Zion Fuentes.
And my name is Isa Contreras.
So before we start off with talking about why transgender women's mortality rates are so high, I first wanted to go over what specifically we will be talking about. First, we would just introduce what a transgender woman is and kind of give a sort of summary of the timeline from which types of terms were used from then till now regarding transgender women. The first section, we will be going over their socio-cultural and systematic barriers to health. Then our second section will cover a specific health issue that we agreed on we think is the most concerning for the group of transgender women and what sort of risk behaviors they might be having to put up with. And our last section will summarize three sorts of strategies that help combat this health issue that we chose in order to decrease the percentage of transgender women who may be dealing with poor mental health issues.
Perfect. So for our introduction, we have what is being transgender? The Merriam-Webster definition of transgender people is being a person whose gender identity differs from the sex the person was identified as having at birth. Transgender is often abbreviated and stated as trans, example, trans women. Referring to trans people has gone through a lot of changes, from being referred to as transsexuals throughout the 60s, 70s, 80s, and some of the 90s, to transgender, to trans in modern day, and now many trans people just want to be referred to as their gender. So healthcare and trans women. Trans women have an extremely complicated history with the healthcare system, both past and present day. Oftentimes, even individuals with full insurance coverage get denied their life-saving medications and procedures due to personal biases. Quote, according to the survey, 54% of transgender women were denied coverage for gender-affirming surgery and 18% were denied hormone treatment. Additionally, 22% of transgender women avoided care for fear of mistreatment by a healthcare provider. End quote. Only within the past 10 years has research in gender minority care been given more recognition. Although still in 2023, trans individuals in states that restrict gender minority care have to either move states or pay out of pocket to have the medications and surgeries that they need.
For socio-cultural and I'm so sorry, hold on, give me 1 second. For sociocultural and systematic barriers to health, we have stigma and discrimination. Within social stigma, transgender individuals often face societal prejudice and discrimination, which can usually lead to mental health issues, stress, and just overall avoidance of healthcare services at all. Discrimination within healthcare settings can result in inadequate care, lack of understanding from healthcare providers, and avoidance of seeking medical attention at all. Limited access to gender-affirming healthcare includes affordability of gender-affirming healthcare, including hormone therapy and gender confirmation surgeries, which can both be super expensive, and most times they're not covered by insurance. There may be a shortage of healthcare providers who are knowledgeable and sensitive to transgender health issues, leading to difficulties in finding appropriate care. Within mental health challenges, we have higher rates of mental health issues. Transgender individuals often experience higher rates of depression, anxiety, and suicidal ideation due to societal rejection, discrimination, and lack of social support. Barriers to mental health services include a lack of culturally competent mental health services and providers who can pose a significant barrier to mental health support. On average, LGBTQ plus folks attend about 34 million appointments for their health, yet 47% of trans folks say they have experienced some form of negativity from doctors or healthcare providers. Quote, the American Journal of Public Health surveyed 1,093 male to female and female to male transgender persons, 44.1% of whom reported clinical depression as a result of their stigma, and 33.2% who reported anxiety caused by their stigma, end quote. According to healthcare.gov, many health plans and healthcare providers are still using exclusions like services related to sex change or sex rearrangement or reassignment surgery to deny coverage to transgender people for certain healthcare services. Healthcare protection guidelines need to be put in place to protect trans rights and help provide safe care for LGBTQ folks, as well as improving the availability of queer competent providers. This means that the healthcare system needs more doctors and providers who have a positive regard and support for their patients when it comes to gender identities and sexual orientations.
So in regards to how transgender women fall in such deep holes of bad mental health issues, many transgender women know at a young age who they truly want to be. With constantly having to deal with feeling lost could lead to heavy mental health issues. Feeling like you're finally who you want to be takes a lot of effort, especially with the factors that are thrown at you at such a young age. UCLA's William Institute emphasizes ages 13 to 17 are significantly more likely to identify as transgender, 1.4%, than adults ages 65 or older, 0.3%. We can see the ratio from teenager to adult here, indicating that the mental health issues can root from such a young age already. Many women, whether they be young or old, experience discrimination in their daily lives. This discrimination can come from complete strangers or people that are related by blood to them. With constantly being discriminated and being unaccepted from their own family takes a great toll onto their mental health, leading them into depression, having anxiety of no freedom of expression, as well as starting to cause self-harm to themselves through ways such as substance abuse or physical abuse. I also, before moving on to the next slide, I wanted to highlight why I use the falling dominoes on this slide, because I kind of just wanted to represent the sort of domino effect that these mental health issues have. Basically, them feeling lost at first kind of just like tolls into trying to discover themselves and who they're most comfortable being, leading them, if they have the confidence to come out to their families as transgender, then some families aren't that supportive, leading them on to getting more stress and developing into falling into depression or having lots of anxiety due to the family unacceptance, also leading them to cope in harmful ways to deal with the unacceptance of either the society they live in or their family or friends. They could resort to things such as substance abuse or physical abuse, harming themselves to very unhealthy extents.
So we have some risk behaviors of mental health issues, some signs and symptoms, and these are just basic definitions. Substance abuse, taking advantage of an illegal or legal substance such as alcohol, pills, marijuana, all that stuff. Depression, a state of melancholy. Self-harm, abuse taken on oneself due to trauma and or mental health. Anxiety, mentally distressed or uneasy of circumstances in one's life. So how do these risk factors affect trans women? Many trans women, as well as other gender minorities, often crave some sense of escapism from the world around them, making them turn to unhealthy coping mechanisms. Quote, rates of addiction amongst transgender people are disproportionately higher than rates of substance misuse in the general community, writes the Center of American Progress. As many as 30% LGBT people report misuse of drugs and alcohol, while the general rate of misuse is only 9%. We can see from these stats how disproportionately affected trans people are, and then just in general, LGBT people are compared to their cisgender and heterosexual counterparts. Substance abuse as a coping mechanism is just self-harm. Taking the trauma and reflecting it back onto one's body can do irreparable damage. Unfortunately, substance abuse is rampant throughout the queer scene, especially the queer club scene. Often, transgender people, especially trans women, feel there is no other option for relief, feeling like they have no one or nothing to turn to, and that a quick something is better than the constant feelings of anxiety and depression, etc. So we have some rates of the poor mental health issues compared to transgender men and the regular counterparts, and how do these rates differ from other groups? Unfortunately, for trans women, it is the highest. Gender minority individuals compared to their sexual minority counterparts face higher rates of mental health issues. On average, gender minority individuals are more at risk of seclusion, hate crimes, and in current times used as political leverage. Although transgender women face higher stats of anxiety, depression, and other mental health issues compared to transgender men. Quote, descriptive statistics of predictor and outcome variables are displayed in Table 1 to our right for transgender men and women respectively. To examine whether there are mean differences based on the study variables, t-tests for independent samples were conducted. Differences in anxiety, body image, social loneliness, and sexual satisfaction were found. Transgender women showed higher levels of anxiety, social loneliness, and sexual satisfaction, and a poor body image. Yes, trans women may be up in sexual satisfaction, but we have to think about the fetishization of trans women as well, and how that can affect their every day-to-day life. There could be many factors for why trans women face higher rates of anxiety, depression, and other mental health struggles. Trans women are entering a world that already looks down upon cisgender women, forcing them to face even worse symptoms of this, such as trans misogyny.
In regards to how these poor mental health issues could be diagnosed, it could be diagnosed in several different ways. Many transgender women don't realize that they have depression, anxiety, or that they abuse substances as a way to cope with any emotion or stress because, as anybody would in their heads, they would just think it's just, you're just sad, you're just not having your best day or best week, or you just been out of it for a while. So when they're experiencing this, they don't really think it's something that serious to that extent. So until someone professional diagnoses it as something serious, then that way they will know that they are officially diagnosed with all those symptoms. One particular way that poor mental health issues could be diagnosed would be with any regular doctor visit that may be put into action, such as checkups, or just if some doctors mainly just schedule appointments every so amount of months in order to check in with their patients. With any doctor visit, there will always be follow-up questions. And with altering changes from last time's visit to one's moods or daily lifestyle, the doctor may come into conclusion that you may have one of those symptoms of poor mental health. In another scenario, the transgender woman might be attending therapy sessions or relying on close friends to let know their emotions in order to cope with what they might be dealing with. And both might infer that it's a possibility that they have poor mental health issues, while suggesting for the person to receive professional and or doctor help in order to become better from what state they might be during that time. Therefore, these are three main scenarios in which a transgender woman could be diagnosed with mental health issues such as depression, anxiety, self-harm, or even substance abuse. Now, with every issue, there's always a sort of treatment that helps people in different ways. Some people prefer physical ways, such as talking to somebody, or some people prefer ways such as taking drugs that help them, which is medication. One way that they could be helped is in therapy. Therapies are one-on-one conversations with a professional who knows the brain very well, and in some situations, they are extremely helpful for some people because they prefer having just some alone time with one particular person instead of things such as support groups, which involves more people, or they feel the pressure of opening up to a close friend or a family member, and they just prefer somebody that doesn't really know them personally, and that way they can just talk to them about their mental and emotional state. That way, with a therapist, you can be helped to connect with their emotional and mental state much better than you would be if you were to be on your own dealing with all the loads of stress and feeling in a state of being unaware of what to do. About 75% of transgender women are able to receive successful help with therapy sessions. Another form of therapy, which just creates the range or number of people that you're talking to in that situation a bit bigger, would be support groups. Support groups really fill the void of similarities and no longer feeling the feeling of lonesomeness. There are groups such as these in order to find someone that could possibly and most likely to relate to what you might be feeling, as well as possible strategies that arise due to the conversation that may be referring to poor mental health issue. The group is meant to make you feel supported and suggest possible ways that might have helped others in the group feel better in regards to depression, anxiety, substance abuse, or even self-harm. Another treatment that could possibly help transgender women would be medication. For symptoms more focusing on depression and anxiety, there is medication to make the pain that is experienced less than what is already felt. Of course, many women can choose to not rely on medication and go towards treatments such as support groups or therapy sessions. But it does help lots of women who choose to have the preference of relying on medication in order to help them get out of that poor mental health state. The way this helps is chemically in this situation. With the use of these medications that are usually called antidepressants, also work towards for anxiety issues. They increase the amount of neurotransmitters, which improves the mental health of the brain itself, preventing yourself from falling into such a deep dip regarding feeling depressed or having anxiety or bad thoughts that may lead to harming yourself.
All right. What is the issue? High mortality rates among the transgender women is an issue and must require a strategy. Intervention is needed to ensure that there's ways that transgender women are safe. By proposing a strategy, it's important that we have a strategy that can be done to address the high mortality rates, to better access to healthcare. Transgender women face a lot of challenges when it comes to the access to healthcare because of discrimination or the fact that there are certain barriers that stop them from ensuring good quality service. Supporting evidence, as shown from this provided expert, access to effective services is imperative to address the many health and mental health disparities that lesbian, gay, bisexual, and transgender LGBTQ people face. This population, however, remains underserved and often ill-served in healthcare environments. Reasoning for that is to emphasize what this quote is saying is that there needs to be healthcare services that address the health disparities transgender women face. It shows the issue of how poorly served they are within the healthcare system. It mainly points to challenges that this specific community has to encounter to attain simple healthcare. It is clearly highlighting that there needs to be improvements to the healthcare system and there has to be improvements to ensure the diverse health of these individuals. The existing healthcare system failed to meet the specific needs that these transgender women face. Why is it important? Well, health is important for everyone, so everyone needs to have the same amount of treatment. Transgender women don't receive this treatment at all times because there is discrimination or insurance does not cover all of their expenses, which can be very difficult. The strategy to make access to healthcare easier will not only reduce the harsh mental health issues, but it will most definitely help enable the early detection of the potential problems. How? Well, working with groups that help push for transgender women's insurance coverage can help ensure that many with the same issue can combat it together. There are certain policies that make it harder for transgender women to pay it off, so there needs to be better counseling services or guidance to help with the cost. As well as making sure that discrimination is well aware to the public, there will be a lot of people advocating for better treatment. As said in Social, Culture, and Systematic Barriers to Health by Dr. Emitu, 29% of sexual minority and 73% of transgender individuals perceive that they would be treated differently by medical personnel if they are open about their sexual orientation, gender identity. Many LGBTQ plus individuals believe that they may be denied health services altogether. When should we implement it? Well, implementing this strategy is, of course, a process, but it requires enough engagement by a lot of public advocacy to bring awareness to the issue. Whether we advocate for better laws where we protect transgender women or even bring healthcare providers accountable for not providing the respectful care, it is a process that must require persistency from each individual. Then, many transgender women will receive the same healthcare providers and treatment.
Our second strategy for combating the high mortality rate among transgender women would be implementing public domains where transgender women can have access to speak and find community among other transgender women. And before starting off and really getting into it, I wanted to kind of build off and say that this may seem similar to what Alexa said about support groups, but for just having this kind of public domain, I kind of wanted to emphasize that it would be kind of available whenever, and that it could be like either online, in person, and there isn't really like any specific target of it. So why would this strategy work? The reason as to why this strategy is being suggested in general is due to the relief and prevention it can bring to lower the mortality rate. The minority stress level demonstrates that LGBTQ individuals are prone to experience targeted stressful situations and events that are based on stigma and overall anti-LGBTQ discrimination. By providing these safe spaces specifically for transgender women, by narrowing down issues and concerns faced by that specific demographic, we can receive more intimate and resourceful interactions. So again, building off on the why, this might not seem like a really, it says that I'm running out of time. We have 10 minutes left. Okay, hold on. I'm gonna start over. Hold on. Okay, hold on. I'll figure it out. So why, for this reason, the reason as to why this strategy is being suggested is due to the relief and prevention it can bring to lower this mortality rate. The minority stress level demonstrates that LGBTQ individuals are prone to experience targeted stressful situations and events that are based on stigma and overall anti-LGBTQ discrimination. By providing these safe spaces specifically for transgender women, by narrowing down issues and concerns faced by that specific demographic, we can receive more intimate and resourceful interactions. So when should we be implementing these? The implementation of for the safe spaces isn't specific, as it could be helpful for any trans woman at any set period in time throughout their transition. These spaces should have easy accessibility, as they could help relieve the troubles, questions, anxiety, and overall curiosity of transgender women. These spaces would provide support for transgender women whether they're beginning to question their identity or have already begun living as their authentic selves. How? Awareness and empathy, and I wanted to kind of emphasize on empathy, because while this group may be for transgender women by transgender women, often within the community there's still some sort of like competitiveness within like women transitioning and how far you are, and there's a lot of different already like violence and stigma like within the community. So I do think that empathy within transgender women would be really important in these cases. So the way that this strategy should be pursued is by being open to the idea itself. It wouldn't be an exclusive space, but more so an intimate and deeper space. It should be important that healthcare providers, specifically those prescribing hormone replacement therapy, also speak about the mental health changes and provide transgender women these resources for support and guidance. Members of the LGBT community would again understand that this isn't meant to be a space that excludes the rest of the community, but instead dives deeper to provide and share experiences, situations, and services. There are personal matters that lie within people behind this acronym. For example, a broader example would be a safe space for transgender people, but the experience of, a transgender woman wouldn't be the same as that of a transgender man and that of a non-binary person. Overall, with these spaces for transgender women, the impact on the mortality rate health concern may not seem direct, but it still lies there. With the right support and appropriate resources, transgender women would be able to discuss and deal with topics like depression, substance abuse, and coping mechanisms, both good and bad, all of which can lead to health issues or suicide, impacting the mortality rate for transgender women. And these are some experiences and impacts left behind these safe spaces that I found. So, quote, getting to know these role models through GLOW, which was a LGBTQ organization at this college for geoscience people, gave me the courage to be my full self at work, and I wanted to help create that space for others who may be the first or one of few LGBTQ folks at their institution, end quote. And then this is another quote that I found. So, quote, data revealed that the internet offers TGD youth affirming spaces that for the most part do not exist in their offline selves. Online TGD youth were able to engage meaningfully with others as their authentic selves, often for the first time. These experiences fostered well-being, healing, and growth through 5 processes. 1, finding an escape from stigma and violence. 2, experiencing belonging. 3, building confidence. 4, feeling hope. And 5, giving back, end quote. There aren't many other resources that I found, but it kind of just further proves how limited these spaces are. So I think it's important that we work on this.
Okay, so the last strategy that we came up was implementing legislation policies and tactics aimed on minimizing transgender discrimination while extending access to gender affirming treatment that has possibility to reduce mortality rate. So why? So implement since transgender women come from a variety of backgrounds, these techniques proposed for trans women regularly face discrimination, harassment, and some cases violence because their gender identity or gender presentation differs from their birth assigned sex. In order to minimize this and reduce mortality rate, it must be done to create laws and policies that protect transgender women from threat and discrimination. So according to like the evidence that I read during National Center from Transgender Equality, 63% of transgender women have encountered significant act of discrimination events that have significant impact on persons' quality of life, capacity to support oneself financially and emotionally. So enforcing laws, when laws and policies for transgender identity have some current policies and laws, which is called like the Equality Act, but enforcing more policies to protect on transgender women will allow them to feel protected and cause them a relief on feeling discriminated of not being treated equally. So basically, to like a little breakdown is that there is policies that I did research on that are focusing on all the LGBTQ community on helping them protect on discrimination, but enforcing more because there's like a high mortality rate on transgender women. Enforcing more laws or creating policies to protect transgender women will help them will help possibility of lowering the mortality rates. And then you can move on to the next slide. Okay, so a little bit breakdown on the Equality Act. So the Equality Act would expand federal civil rights laws to protect LGBTQ plus individuals from discrimination in employment, housing, credit, jury service, and federal support programs such as health and education, as well as public places and space. And this would, if we implement more law policies and laws to target more transgender women, it will help primarily targeting transgender women will help them achieve equality to protect them from damage and discrimination, and the source of developing better options to make life easier and more convenient for transgender women. Enforcing equality will allow transgender women to receive medical care without fear of being judged, to participate in programs and communities, to find housing and jobs.
These are our works cited, and it's just a brief and thorough explanation of resources that we found that really helped us engage thoroughly with this presentation. And yeah, thank you so much for watching and listening to us.
Thank
Thank
you.
you.
Thank you.
And then, so sorry, Professor, we are using the free Zoom, so we did have a little timer to run out. But yeah, thank you for listening.